Assalamu alaikum, मैं तल्ला चौधरी. I am working as a resident general surgeon, Nishtar Hospital, Multan. In this video, I will explain TNM staging system for breast carcinoma. This staging system is taken from Bailey and Love 28th edition. So, in TNM staging system, the first component is T, other is N, and is the M. So T is the tumor size. T is the tumor size. So T0 means no evidence of primary tumor. T0 means no evidence of primary tumor. And TX means primary tumor cannot be assessed. Primary tumor cannot be assessed. And TIS means in situ. Tumor in situ, that is DCIS and Paget's. So carcinoma in situ means the tumor does not invade the basement membrane. So if the tumor does not invade the basement membrane, it is carcinoma in situ or tumor in situ. One is the DCIS, ductal carcinoma in situ, and other is the Paget's disease. I have simplified this table in this slide. So T1 means tumor size less than 2 cm in greatest dimension. T2 means tumor size is in between 2 to 5 cm. T3 means tumor size is greater than 5 cm in greatest dimension. T4 is classified into 4 subtypes: T4A, T4B, T4C, and T4D. So in T1 is further subdivided into T1A, T1B, T1C. So T1A mean tumor size is between 1 to 5 mm. 1 to 5 mm. T1B means tumor size is between 5 to 10 mm. And T1C means tumor size is between 10 to 20 mm. And T1MI, micro invasive, it means tumor size is less than or equal to 1 mm in greatest dimension. So T2 is tumor size is between 2 to 5 cm in greatest dimension. T3 means tumor size greater than 5 cm or 50 mm. As we all know, 1 cm mean 10 mm. So T3 means tumor size is greater than 5 cm in greatest dimension. So T4 is classified into 4 subtypes: T4A, T4B, T4C, and T4D. T4A mean tumor is extended to the chest wall. Chest wall has 3 components: serratus anterior, intercostal muscles, and ribs. If the tumor is adherent or invaded the pectoralis major, it does not fulfill the criteria of T4A. Remember this. For T4A, tumor must be extended to chest wall, that is serratus anterior, intercostal muscles, and the ribs. So there are 3 components for chest wall extension, serratus anterior, intercostal muscles, and the ribs. If the tumor invades only pectoralis major, invade or adhere, if the tumor invades the pectoralis major or adheres to pectoralis major, it does not fulfill the criteria for T4A. Remember this. So T4B means skin ulceration or or ipsilateral macroscopic satellite nodules or edema, that is POD orange, that does not meet the criteria for the inflammatory carcinoma. T4C means T4C means T4A plus T4B. T4A plus T4B is equal to T4C, and T4D is the rapid onset of edema, breast erythema, or POD orange appearance, or warm breast with or without underlying lump or mass. That is uh, actually breast edema or breast erythema or POD orange has following characteristics for the T4D. Duration is less than 6 months. Duration is less than 6 months, and breast edema or breast erythema involves at least greater than one third of the breast. And third is the confirmation of invasive carcinoma on biopsy. Invasive carcinoma on biopsy. So this is the criteria for T4D. In TNM staging system for breast carcinoma, N is the lymph node metastasis. N is the lymph node metastasis. N0 means no evidence of lymph node metastasis. NX means lymph node metastasis cannot be assessed. And N1 means N2 and N3. N1 means metastasis to ipsilateral axillary lymph node level 1 and level 2. So N1 means metastasis to ipsilateral axillary lymph node level 1 and level 2. Level 1 and level 2. And N2 means metastasis to axillary lymph node level 1 and level 2 but fixed to each other or other structures. So difference between N1 and N2 is a movable lymph node in N1 and fixed lymph node in N2, and N3 is the metastasis to ipsilateral infraclavicular, supraclavicular, and internal memory as well as axillary lymph node. So I have simplified this table in this manner. This N1 mean metastasis to axillary lymph node level 1 and level 2 but movable, that is the N1. And N2 means metastasis to axillary lymph node again level 1 and level 2 but fixed to each other and fixed to other structures. And N2B means metastasis to internal ipsilateral internal memory lymph nodes. Ipsilateral internal memory lymph nodes. So this is the N2B, and N3 N3 is further classified into three types: 3A, 3B, and 3C. 3B means metastasis to infraclavicular lymph nodes, that is the level 3 axillary lymph nodes. Level 3 axillary lymph nodes, these are the infraclavicular lymph nodes. And N3B means this is the N2A as well as N2B. So N2A plus N2B is equal to N3B, and N3C means metastasis to ipsilateral supraclavicular lymph nodes. So this is the lymph node metastasis. N in breast carcinoma is classified into N1, N2, N3. N1 means metastasis to axillary lymph node level 1 and level 2, that is movable. N2 means metastasis to axillary lymph node level 1, level 2, that is fixed. And N2B means metastasis to ipsilateral internal memory lymph nodes. And N3 is further classified into three types: N3A, B, and C. A means metastasis to infraclavicular lymph node, that is axillary lymph node level 3 ipsilateral. And B means N2A plus N2B. And N3C means metastasis to supraclavicular lymph nodes, that is ipsilateral. So I have simplified this table in this manner. Hope this helps you a lot. In TNM staging system for breast carcinoma, third is the M, metastasis. M0 means no evidence of distant metastasis. M1 means there is a evidence of distant metastasis clinically as well as radiographically. So one term is M0I plus, that is micrometastasis. No clinical or radiological evidence of distant metastasis in the presence of tumor cells or deposit that is less than 0.2 mm. 0.2 mm. This is the micrometastasis that is usually detected microscopically or molecular techniques in the circulating blood, bone marrow, and other non-regional lymph nodes in a patient without symptoms and signs of metastasis. So hope this lecture helps you a lot. Follow me on this YouTube, Instagram, TikTok, Facebook, and you can also give a feedback. Thank you so much.